I'm going to focus on some of the technical aspects of the hair transplant. For the storage solution, in the old days, I had some good experience with hypothermosol. It works really well. But now I'm going back to normal city for some reasons. First of all, hypothermosol is expensive and it's not easily accessible in my country. And thirdly, grafts soaked in hypothermosol makes the whole texture very soft, making our implantation very, very difficult. These are the reasons that I shift back to normal city right now. And normal city is a standard, gold standard nowadays. So from the previous study, we know that the overall graft survival are similar for the first 6 to 8 hours, no matter what kind of storage solution you're using. However, the overall survival drops dramatically after 24 hours. So it's prudent to say that if you use normal saline for a few hours initially, the results should be comparable, should be good. The gold standard is to use chilled normal saline nowadays. However, 2 years ago, Michael Biener of America, he came up with an article claiming that grafts stored at room temperature give a better yield. This is really stunning. And I had a comparative study 6 months ago on 10 patients. One side I used chilled normal saline, the other side room temperature. The results initially are comparable. Results are still pending. I'll let you know in one of our future meetings. PRP, laser cap, they all work well on vellus or miniaturized hair. The results are comparable. And in my practice, I prescribe laser cap and PRP only on those patients who do not want surgery or medication. In my practice, if my patients are taking finasteride, I do not prescribe PRP laser anymore because they are just overlapping and they do not produce synergistic effect. Postoperatively, in the donor area, I applied Vaseline instead of the previous antibiotic ointment. Vaseline has several advantages. First of all, it forms a protective barrier on the wound, and it prevents the germs from entering the wound. Secondly, it is effective in keeping the wound moist, preventing drying out of the wound and scape formation. And thirdly, it can stop bleeding in small cuts. That is the reason why I use Vaseline. And the neck pillow, for the patients who have hair transplant on the crown area, I advise them to sleep on the neck pillow to prevent the dislodgement of the grafts overnight. And the painkiller, most of our patients nowadays do not feel pain on the night of the surgery. Any painkiller like paracetamol may be prescribed as needed. We ask the patient to come back for shampoo. Any shampoo will be okay, no any specific predilection. And lastly, oral antibiotics. It is no longer prescribed anymore because it has been proven to be unnecessary. Thank you.
Thank you, Danny. So we've learned from all the master. Now, can I have my slide, please?